Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome a remarkable guest, Michele Bolton. Michele is the founder and CEO of MY911. Welcome, Michele. How are you?
Oh, I'm great. Thank you so much, Lance, for having me. I really am excited for this conversation today.
We've been looking forward to it. So I want to just have you take a moment for people that may not be familiar with you or My911, and just explain a little bit about your backstory, how you got into this, and what My911 is all about.
Yeah, of course. Thank you. So my little backstory here, it goes quite back far actually, with my 911 because it initially started in my 20s, when I was farming at the time. So I lived on a farm and I farmed for 30 years and I transferred kind of and pivoted my career into wealth management, and then now into healthcare. But it initially started with a number of emergency surgeries in my 20s that I ended up having to face, all unexpected, 23, 25, and then at 28 years old. And then I thought I was clear. And I got through them, and that was great. And then when I was 30, I was diagnosed with a life-threatening condition of teratoma, which is basically like an embryonic tumor that started when I was conceived in my mother's womb, if you can imagine. So they never discovered it until I was 30. And so a week before I turned 31, I had to have open heart surgery.
Wow.
And I go deep into the book with this, but at the end of the day, they advised me to say goodbye because they didn't know if I would make it through the surgery. The tumor was just too large. So I had to say goodbye and was very surprised to wake up. But when you go through traumatic events like that, it really does change how you view life overall. Because, we all think that, oh, we're invincible when you're young, we're healthy, and and it's all great. And it's only the older people who get sick, right? And it's not necessarily young people. So when I had gone through all of this, I started, in 2018 being screened for breast cancer. And I thought, oh, here we go again. I thought it was all done and it started again. And, thank goodness all of that was fine. But through that process, I really did uncover a gap in healthcare that I found, which was the inability to communicate on a consistent basis when you're in an emotional state. And when they're constantly asking the same questions from registration and going into one department and going into another department and another appointment, it's all the same questions. And for me as a patient, I was just so frustrated. I was emotional, I was upset, I was scared. And I thought there has got to be a better way to do this, because when you are emotional and you're in a lot of pain, you're not thinking clearly.
Right.
So you may not be answering those questions correctly for first responders or any healthcare professionals who might be, needing that information to give you the correct diagnosis of what you're currently dealing with. So I basically went home and created my 911, the wallet card that we have today. And it displays a QR code on the back that's linked to your online emergency profile. So basically, people have the opportunity to share that critical medical information that they need to share or they want to share with whoever, obviously is asking for that information to stabilize them or to, speed up the conversation in what's going on today so they can actually have a good, thoughtful conversation around a solution to their current matter instead of repeating history and and going through their medication list and all those things. So that's kind of where it came from.
Yeah, that's
Long story,
yeah,
but
no,
I
no,
tried to speed it up.
and it's an important story, Just out of curiosity for my own knowledge, I have an extensive healthcare background. I was pursuing medical school before my father came to live with me, and that kind of changed my story. When, when you have a congenital, abnormality like that with your teratoma, is that something that would be detected today, Michelle? Just out of curiosity.
That's a really good question. Because there was no pain.
Yeah.
For me, there was the only reason I went to the doctor really was because I couldn't catch my breath. So I would climb, I worked out all the time, and it was no problem. I was quite active.
Yeah.
So one night when I got home, I was couldn't even climb a flight of stairs without being completely winded. And I thought, well, what's going on? I think I have bronchitis or just a really bad cold, right? A chest cold. So that's why I went in, and he only found it because he said, "Well, you actually have a heart murmur, Michelle, and we'd like to do a chest x-ray." So I'm like, "Okay, no problem." I thought I'd be going in, getting antibiotics, going home, and that would be it. But after the x-ray, he came into the room 15 minutes later and said, "Well, the three of us actually feel you may have Hodgkin's disease." And I just said, "Well, what's that?" I had no idea.
Mm.
And he said, "Cancer." And I said, "What? What are you talking about?" And he said, "Come here, I want to show you something." So he took me into the x-ray room, and I just looked at the x-ray on the wall, and what is that? Because this thing was so large, it took up my entire chest cavity. It was just
Wow.
white. You couldn't see my heart, my lung, nothing. So I instantly, of course, I'm in tears and in shock, thinking I was just going to get some antibiotics and go home. But that's the only way they discovered it. Otherwise, I was fine. I didn't have any pain. I was winded, and I
Sure.
felt a few things through my teenage years when I worked out, but nothing to ever
Cause alarm.
consider there was a huge issue. No, ever.
Wow.
Nothing. So
Wow.
I don't know how they would do it today. They're incredible. Obviously, physicians out there who can diagnose, but this was a long time in the making, and it wasn't until I completely ran out of room in my chest to breathe that that I found it.
Oh, wow. Well, thank you for sharing that. Yeah, I want to talk a little more about my 911. What are some of the different scenarios that it can apply to?
So, yeah, that's such a great question because I think when people feel that they're fine, they have no problems at all. If you're trying to juggle changing medications with a chronic condition, maybe there's diabetes, maybe there's some heart problems or cancer, maybe there's MS. Like it depends on the condition, of course, but when you're trying to juggle different medications and tr keep track of um, the various appointments and things like that, there's really no way of doing it effectively, I find, except having this ability to jump in and update your card quickly. So anywhere you are in the world, you have access in your back pocket to your information. So that's one, I think, scenario that's really important with chronic conditions. I find that, I met a gentleman in Detroit Airport when I had to go to Miami, and his wife was really upset because he forgot a medication that was critical for him. And he said, "I looked everywhere for that in the hotel room except for the fridge." He
Wow.
forgot. And it had to be refrigerated, so he forgot it there. So she was really upset. And he pulled out this list of medications, 8.5 by 11 medications and conditions he had. And I was shocked. And I thought, so I pulled out my wallet card and I just, pulled out my little card and I said, "This will solve that problem." And she was just like, "Where did you get that?" And and I said, "Actually, I created this for this reason, right? To have my information with me. So when you're traveling, if you do forget something, then you can go to the local pharmacy wherever you end up, pull up your information and say, 'Can you please call my doctor and have a new prescription faxed here so that I can have it when I'm here instead of, being out or having to go back home or, just feeling completely devastated by if it's critical information or medication and you need it." then what do you do? Or if you're snowed in somewhere, or if there's a disaster. I'm not sure how people really handle that currently because, as you know, it's hurricane season down in the States. When people are being evacuated, do they remember all of the medications to bring with them? Do their family members know if they had to speak for their partner or any other loved ones on their behalf? So that's another scenario. I think another important one for me, I find is, I'm in the sandwich generation a little bit. My daughter's grown up now, but my mom is older, and, we'll all be a caregiver at some point. How do you still manage all of the changing information with various people you're taking care of and not, being so overwhelmed and burned out yourself that you burn out and you're no good to anybody? So I think as a caregiver, if you don't have to, fly from another state or another province here in Canada, and you're able to manage that information from wherever you are and provide consistency for your mother, your uncle, whoever it is, then, that's powerful stuff. That saves a lot of money and time
Yeah. And
because we
mistakes.
can't predict an emergency. That's exactly what emergencies are. They are unpredictable, unexpected, and those are the times we need this. But most people are just not prepared
Right.
because it'll never happen to me scenario, right?
Absolutely.
And we don't know what we don't know. And I'm trying to get ahead of the curve for people to empower them to advocate for themselves, save a lot of time and grief and frustration in the process, and provide greater peace of mind by having this information prepared in advance because you're either answering the question a million times or you can do it in advance once
Yeah.
and make sure it's correct.
Absolutely. A couple of things I just want to follow up on what you were sharing. You said it'll never happen to me. A lot of people have that mentality, but I kind of flip that back on people because they'll say it to us with our company quite a bit. And I'll say, do you have auto insurance on your car? Well, yeah, of course I do. Well, how many people get auto insurance because they think they're going to have an accident? They get it because you have to. This should be the same mentality and the same approach. You need to get the My 911 just so that you have it, not because you necessarily think something's going to happen, but in the event, the one out of a million times that it does happen, you're prepared and you're equipped to, respond accordingly. You know,
Yeah, and just a quick note of reference. So in the United States, my company is My 911 Life. And in Canada, I'm under My 911. So anyone in the US wanting to do some research and find out what we're doing is my911life.com. And but you're right. We prepare for so many other things in life, and we have our credit card information with us, we have our driver's license with us, but I find no one has their critical medical information with them.
yeah,
So if you're out in a theme park or, you've gone out to a beautiful restaurant or you're on a cruise ship somewhere, no one knows anything about you
right.
except, and even your partner might struggle because what if you're both unable to communicate, not just one of you? What do you do then? So there's so many situations actually, Lance, that this can really be effective for. Yeah.
And just for our Canadian friends, because we have a lot of Canadian friends and listeners, it's my911.ca, correct?
Correct.
Yeah.
Yeah, my
And
911.ca.
we're going to
Yeah.
have all these links in the show notes and up on the
Yeah.
screen for the viewers, Michelle. But one of the other things I wanted to talk about was scenarios that I could see it being very effective is, we take care of a lot of individuals who have dementia or some kind of cognitive, disease or illness or regression. And they can't always provide a good history. They can't always provide what medications they're on. And they don't always have family that is living nearby or very actively involved and might be long distance. And when it's, the family, even if you do get in touch with them, sometimes they're not even as aware or up to date on what their mom, their dad, whoever it may be, condition is and medical history and current scripts. I could see this being a really effective tool for individuals with dementia because, when we send a caregiver into the house, we try to brief them and support them prior to them entering into the home. But once they're in there, they're going to learn and discover and see new things that the family wasn't able to provide us information on because the family didn't know. But if you have
Yeah.
the card, this is a great way where they can see all the up to date healthcare information and different things. So I see so many, really pertinent uses for this, even for children, right? I mean, I coach soccer for our school's varsity team, and you're on a field, you'll have your cell phone, but you're not going to have the student or the player's student file with you. And if they have a medical condition, you should be aware of it already, but you may not know their medications unless it's maybe like an inhaler or something like that. So that would be another great resource, I think, for student athletes or even students in general.
Yeah, the timing of that point is so really, really interesting because I met with a gentleman yesterday who's an assistant coach of a hockey team, and he said that exact thing, Lance. It's funny you say that because he said, he was asking about my 911 and I was sharing it with him and why I started it. And he said, you know what? That makes so much sense because he said I walked by one of the kids' um, bags, team like their hockey bag, and he found an EpiPen. And he said, well, what's this for? And he said, well, I'm allergic to peanuts. And he looked at me and says, that would have been really good information
Yeah.
for me to know, so, and I'm like, exactly, these kids, I mean, who speaks for them if something happens to the parents or they're not around and they're on a traveling, soccer team or hockey team or whatever, you know, a lot of coaches and other parents don't know,
Yeah.
right? So, how do you protect these kids even? And if there's students going out of country to another school or college or university, the same thing, right? Like their new cohort of friends or professors, they're not going to know anything about them.
Yeah.
So, how do you effectively make sure that these kids are prepared? And it does provide a lot of peace of mind for the parent, right? Knowing that, they're covered. I don't have to think about it or worry about it. Because there are a lot of just different conditions that, people are dealing with. And maybe it's ADHD, maybe it's autism, maybe there's just a lot of different things that parents and other people are going through that, they just don't know how to really manage all of the information.
Right.
And you make a great point with dementia and Alzheimer's, and I'm not familiar with that condition. Personally, I haven't dealt with anyone who's had it. So, but what I do know is my sister did deal with it. And, it doesn't show up immediately in like just overnight, I don't think. And it can be a gradual process for people. So if we can get them on this card and on the system in advance of that progressing condition, it not only empowers the individual having to go through it, it gives them more confidence knowing that, okay, I've got a backup here. I don't have to try to remember
Right.
all of those really important the information that I'm going to be prescribed, the wrong medication that might interfere or I'll react to. And they're going to be able to keep that up to date as they need it. And then if the caregiver then or the child or whoever's dealing with the individual, they have to put them into a home, like you say. They've got something they're ready to go with and not trying to figure out all this stuff at the last minute. So yeah.
I know we've talked a lot about users and who it can benefit and who it's really meant for. And I think at the end of the day, it's probably something everybody should have, regardless of who they are, right? But walk us through a little bit about how it actually works. So let's say, one of our listeners or viewers decide, I'm going to get this because my mother needs it, my father, or my kids, or I need it. How do you use it? Do the healthcare providers keep it updated after an appointment? They send in a new script. They can like load it into the portal or add it to your card, or is this all user entered information?
Yes, this is self-directed for the user because what I have found is, and especially after COVID, we were all locked down for 2 years and everyone lost their control and their rights over everything. And I find here, I've had a lot of conversations with people. They want control over the information they're sharing because there could be, really sensitive medical things that they're dealing with they don't want to share. Maybe there was, abuse. Maybe there was, um, you know, some rape, or someone tried to commit suicide, or we don't know. Like, everyone's medical history is different and their conditions, and they don't want to have to go down that road necessarily because somebody uncovers it. So I'm allowing everyone to update the information. Basically, all the questions you are constantly being asked during an appointment, that's the information you're going to put in there. And they have the ability to choose what's printed right on that card. So if they need an EpiPen, things like that, or if they have, if they're diabetic, they're going to want to put that right on the card.
Yeah.
So, yeah, it gives them full control over the information. It's not connected, it's a fully independent system so that they have control over who they're sharing it with.
Okay. Now, what if a doctor wanted to add? Is that a feature that they could?
It's something I'm looking into right now. In a different manner though.
Okay.
And I'll let people know when that is available, but right now it's strictly for the patient or the caregiver with legal power of attorney
Okay.
to operate that profile for the emergency contact. So,
Wonderful.
or for the patient, yeah.
Okay. Great. I know you've kind of talked about it, but if you wanted to just kind of summarize it one more time, why emergency preparedness is important regardless of your age.
I think for greater peace of mind for everybody, because with an aging population, lack of doctors, shortages everywhere, a lot of immigration, people moving around. We're in a transient society where we may not always have access to our records, and we cannot predict an emergency. So I think whether it's an evacuation or, um, a sudden emergency or a massive accident, that obviously we don't expect, it is important to have that. It just saves tremendous amount of time.
Yeah, absolutely. You mentioned a word that's a buzzword around here, and that was caregivers. Why don't you talk a little bit about the flexibility of use for the caregivers?
Yeah, so I think as a caregiver, it's a big role. It's not just, I'm caring for someone, but there's deep emotional impact when you are caring for someone and you're repeating the information.
Mhm.
And let's say, I think of caregivers who may have to rush their loved one to the hospital. Are they carrying bags of medications? Or are they able to just grab the card and go? If you are evacuating from, God forbid, a hurricane or a wildfire somewhere, do you remember everything you're taking? Because, where is the information being stored? I think that as caregivers, they could get burned out pretty quickly. It's like they're on call 24/7, right? So if they have a family they're trying to also care for and live their life with, this allows them that flexibility to say, hey, my brother or somebody else, here's mom's card. I'm going to go away on a holiday for a week and unplug. Do you want to take care of her? Can you take care of her? Can you help her? The caregiver instructions are written right in there. You don't have to think. It's just, here's the card. Please take care of her. I need a break. So I think the flexibility of being able to come and go or live in a different area and still have the control over the profile to keep it updated and provide the consistency that, healthcare professionals still need um, to help that patient. I think it's just the flexibility around that and the peace of mind around that is tremendous, because if there's rotating support worker, I mean, there's so many things, right? You know, People are repeating themselves, and I think it's got to be very tiring. I know I was tired just as the patient. So,
Yeah, it's a
yeah.
lot. It's a lot. Well, it's a great segue to this question, Michelle. Talk about the empowerment that this gives to patients.
What I've heard from my members is the confidence they have when they do go to a doctor's appointment. It doesn't have to be just an emergency, right, Lance? When they go to the doctor's appointment, they don't have to try to remember, oh, I'm on this white pill and it starts with this, and I don't know. It's maybe they have a list of 7 different medications. How do you remember the details, the frequency and the name of it exactly? Because the names you can't even pronounce half the time. The dosages, things like that. it's really important to have confidence in what you're telling them because then you can stop them in their tracks. Say, no, I'm allergic to that. You can't give me that. And then it has all these different repercussions if it's not correct. So I think by allowing the patient or the caregiver, to have control over what they're sharing, there's real confidence in that because they're the ones making that decision on what they need and what, to share. And they don't have to worry about, maybe this pharmacy has it wrong and maybe this doctor doesn't even know. So I think the empowerment behind that, um, it just gives a lot of confidence to people. It doesn't matter how old you are either. And I think as we get older, it's scarier going to the doctor, and there's a lot of anxiety around medical issues, right? So if I can help, empower people to reduce some of that anxiety through this service, that's all I want to do.
Yeah.
I just want to help people because as a patient, I know what it was like. It's not fun.
Right. No, absolutely. Michelle, is the platform, so walk us through, somebody signs up, they get their card. Do they download an app? Do they go to a website? How do they enter the information and like enroll in the process?
Yeah, so all they have to do is go to the website in the US or Canada, and they go through the registration process, which at that point in time, they pay for the physical wallet card itself, and they can choose the subscription to keep the QR code active, whether they want to pay monthly or annually. That's when they do that. And then once they go through a normal checkout process, like they would in buying anything else online, then there's an emergency profile that's generated for them.
Okay.
So all they have to do is log into the profile, and then we walk them through the different questions, and they, check boxes and choose things. And then there's other areas where they can add additional information, whether it's communication preferences or caregiver instructions, or why I'm taking a certain medication, or why I'm taking a supplement. Doctors may know what you're taking, but they may not know why you're taking that one because it could be used for different
Right.
conditions,
Right.
right? So you can really specify according to all those questions you are typically asked. And then once they go through the form and then they review their summary profile and make sure everything is correct, and they send their card for printing.
Mm.
So it just goes, it's automatic and it goes to the manufacturer and it gets printed according to their custom selections. And when it's ready, it is mailed to them in a confidential envelope. And then once they receive their card in the mail, they just log into their profile and they activate the QR code that's it's a link right beside that emergency profile and it's ready to go. So they can use it during a routine appointment or in an emergency. But I think it's important, Lance, to let people know, let your loved ones know that you have this. So let's say, they don't know, they can't read minds. And if you say, this is my solution, if I go down, here you go, just grab this, call 911, and all the information's ready to go. So that's,
Well, and that brings up another question. Can families, like, let's say I was going to get one for my children.
yeah.
They're going to have their own card. They'll keep it with them. But as the parent, or even a wife, a spouse, whatever the relationship is, can you get a duplicate of that card so one person has a copy of it?
Absolutely. That's a good point because when I was in Abu Dhabi in April, I attended the healthcare conference over there, and my daughter has a copy of my card.
Okay.
So and I let them know if anything happens to me, here's my card. Call my daughter. She's emergency contact on here, and she can help walk through, and she can scan the QR code from Canada to communicate to the doctors over there if there had any, if anything had gone wrong. So yes, you can get duplicates for other people in your family, so everyone's on the same page. But it's, usually the either legal power of attorney or the patient who has control over managing that profile.
Yeah.
So not everyone has control of that, right?
Right. Well, and I know one of the biggest stumbling blocks that a lot of families have that we encounter is they have a power of attorney, but they can never find the documentation. Is there a way to upload documents like that to my card?
No, I don't have that yet. Basically, people are checking a box to attest that they do have legal authorization. We're working on that part too, to be able to upload different documents as in a separate vault, right? So it'll have a separate security associated with that profile. But no, right now people cannot upload. They're just entering the information that they need to have immediately. And then yeah, if they, sign up for the newsletter, we can what we can do is we can get them on the list and keep them updated as things move along. So
And how would you like people to sign up for the newsletter?
usually go right to the website. And I think the US site, I have to add that feature on there yet. But they can just email us. There's a contact page. Just email me and let us know that you want to sign up for the newsletter. On the Canadian site, it's right there to sign up for the newsletter as well. I just launched in Florida not too long ago, so I'm still kind of,
Yeah.
ironing out a few things, but yeah, so it's, just contact me, let me know if you have any questions. And more than happy to either meet with people, connect with people or caregivers and have other calls. So yeah.
Well, and I will say, I've shared, we have a lot of wonderful friends in Canada and some remarkable friends, and we're also only 20 minutes from the border, so very close. What have you found has been like some of the similarities but differences from your approach with trying to get, the My 911 card out there for people from Canada's perspective, and now, coming into the States with it? Has it been more challenging? Is it easier? What's your perception?
I think that it's just new
Okay.
because this has never been done before. So it's like any other new kind of invention. It's a matter of educating people. And I know in Canada now, people get it now.
Sure.
And, I'll run into people, I've heard of you and I've seen this and this is amazing. And then it's like anything else. There's so much information out there for people and information coming at every angle, social media and through obviously webcasts or podcasts and webinars and things. So you have to just keep getting out there to spread the word. And that's why I always share with members, make sure that you share your solution with your family and friends so they know, if anything happens, where to look and what to do. So it's a matter of educating people, really.
Yeah.
um, and all the different media links that I've had, um, have really helped raise the awareness on this. So, and the speaking engagements, things like that have really helped, I think, gain the understand, like the awareness. It's raising awareness mainly for a new system, right? That it's just never been done before.
Yeah, no, that's incredible. I didn't know if maybe because you guys do have the nationalized healthcare in Canada, if that made things easier because this is a resource, if there's like government support for it because of that, or does that not really apply?
It is socialized here, no question. There's always politics and bureaucracy involved, I think, in any system like this.
Mhm. Of
Um, and obviously there's a lot of things out of my control that way.
course.
So, we're certainly challenged, I think, here in Canada with that. But people are starting to really see the difference and they get it. They
Yeah,
really do get it. And I'm excited about that, because I think that they really do understand that it's important to be part of your own healthcare journey because not everyone is going to be able to do that for you, right?
absolutely.
And
Absolutely.
socialized system or not, the waiting lines, the emergency rooms, you're waiting 13 hours. You're waiting, and then you still have to explain all of your information when you are exhausted. So, socialized or not, people, we are paying it, whether it's through time, or we have to, wait 9 months for an appointment or even go to the US for paid care. We are paying through taxes.
Yeah,
And, I think, people say it's free. Well, we don't have to open our wallet when we go in, but we are paying in other ways, indirectly.
right.
And that could cost lives. It could cost, goes through taxes. We all pay.
Yeah,
So when you're part of your own healthcare, I think that there's accountability involved. You're going to take care of yourself if you end up having to pay, right? And if you're not paying for the service, typically you are the service. So I find that when you take an initiative to take control of your own health, and be part of the solution, um, all boats rise, right? With that.
absolutely. Absolutely. Yeah, and I completely hear what you're saying. I used to work in the hospital in cardiac critical care, as a matter of fact, and a lot of the nurses that came over were coming over from Canada because better paying jobs, and they just felt like they had more autonomy to see patients and treat patients. And I've always been interested in that because there was a movement, and maybe it's fair to say it's still active here, where Americans are making the argument we should adopt the same model as Canada. So I always wondered, but we're also how many times bigger than your population? So I just try to figure out how that would scale in my mind if we ever did adopt that healthcare model.
I think it would be very challenging to adopt the model only because you have a lot of complex systems already.
Right.
So, and with the larger population too, how do you mesh all of that together? That is one big job, and I think it'd be extremely challenging to do personally. Um, I mean, I don't know the US system like completely, obviously, or the Canadian system for that matter, because things change all the time.
Yeah.
So you're, having to constantly be up to date on things, which is really important, obviously. But um, there's there's just a lot of complexity and layers to both systems.
Right.
So, and there's a lot of people involved in making decisions. So, it comes down to, I think, regulation and money. Always, healthcare is business, right? For both countries, whether we like to look at it that way or not, we can't, nothing's free, right?
Yeah, that's for sure. You know, I just appreciate your time today, Michelle, and sharing your story and all the incredible work you're doing for My 911 in Canada, My 911 Life in the U.S. We're going to have all the show notes, your handles, and everything in the show notes as well. But I wanted to kind of close out and let you talk about this new exciting book that's coming out. I told you earlier you need to add author to your title now, but your book, the My 911 Story of Facing Fears, Resilient Leadership, and Transforming Healthcare. Share what that's all about and kind of what prompted you to write this book.
Oh, thank you, Lance. Well, you know what? It's really interesting. Over the last 18 months, I get probably 2 to 3 requests every day asking me for the story and different ways they're asking, different questions they have. How did it start and why are you doing this? And, what really happened and different things. And then I had another lady out of California ask, she says, have you ever considered writing a book? And I said, you are the sixth person to ask me that. So I don't know. The light bulb went off, and I thought, I have to write the story. I might as well write it because I just keep getting all these requests. So I've been going deep into that, and it's forced me to look back on this situation. So it's not easy to go through because it was a very difficult time in my life for sure. And painful as well, obviously, but it's a very vulnerable thing to do. And, but I find that if you can share the vulnerability you go through, it helps other people know they're not alone,
Right.
right? And my hope through this is to inspire and to help people understand that they aren't alone when they go through these things. And, we're all human. We all bleed red, we all go through trauma, and it's a matter of how do we recover from the trauma? How do we move forward from the trauma when you have to face your own mortality and at a young age? And how do you use that for the better of society and transforming it to something better? So, that's my hope, is to leave people inspired and but share the raw story of it because it was painful, it was difficult. And I just thought, if people keep asking, I'll say, wait for the book, it's coming out. So I can streamline even that process. I'm all about efficiency. So, the book request was the same thing.
So is this it's mostly memoir?
Mostly memoir. Yep. It's basically the journey from how I started, even back when I was growing up and I got into farming and then it transferred into wealth management. And then, people are saying, how did you get into healthcare? And I'm like, I know, right? Like it's just a bizarre twist of careers. And, no one expects to pivot at this age, so I find it now I'm looking back thinking, okay, this really is an interesting story. For me, I lived it. So, but when other people hear it for the first time, they are, just in awe of it. And it made me look twice at it as well. So, I'm grateful.
Yeah, no, that's remarkable, and we'll look forward to helping to share and promote the book when it's published. Do you have a publication date?
I don't yet. I'm still in the writing
What's your
process.
goal? What's your goal?
My goal is to have it out by the end of September.
Oh, wow. Okay, so that's very quick.
It's fast, but you know what? It's pouring out of me, Lance. I mean, this is like, oh, last week I was writing the one chapter and I'm in tears again. And I called my mom and she's like, oh, she says, do you remember saying this to me? And, I had forgot about it. And when she reminded me, it all flooded back. And I'm like, yes,
Yeah.
I do. Now I do. So.
Remarkable. Well, Michele Bolton, any other comments, tips, suggestions, call to actions you want to leave us with for our viewers and listeners?
Yes, sign up, register for the service. We would love to help you. But I think more importantly, think about your situation for people and their caregiving situations for as a caregiver, as a family. I think it's one of the best things you can do for people is to provide extra peace of mind for them, that they don't have to worry because it's health is emotional for all of us.
Right.
And I think the more empowered we can help one another and prepare for really difficult situations, I think the better off we're all going to be as a society. So I think it's connecting people. I think it's empowering and providing an additional source of, you know, like you say, it's not insurance per se, but it's being proactive
Right.
instead of reactive. I think that's just critically important.
Absolutely.
Yeah.
Absolutely. Well,
Right.
Michele Bolton, founder and CEO and new author from My911, thank you so much for joining us today.
Thank you, Lance. It's such a pleasure. It's great to see you again, too.
Always. Have a great day.
Thanks, you too.
Bye-bye.
Okay, bye-bye.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Michele Bolton for joining us today. We look forward to seeing you again here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.